I ended up having open heart surgery to remove the blood clot from my right atrium. Hi everybody, welcome back to my YouTube channel. Today I am going to be giving part 2 of the day in the life video where they found a blood clot in my heart. If you haven't seen that video, I'll leave a little card for you so that you can go back and watch that, because you can watch this independently, but it'll make a lot more sense if you kind of see the first thing and see what led to this point. I had been admitted, I was in the observation unit, the CT surgery team was supposed to make a decision that night. So I was admitted on a Thursday night. Friday came around and I hadn't heard anything from the CT surgery team. I was supposed to hear whether or not they had made a decision, because I was told the previous night in the ER from their fellow that there was a really good chance they were going to end up needing to do surgery and that it was going to end up needing to be pretty emergent. They sent in a different cardiologist than I had had before and introduced himself. He talked to the surgeon, and the surgeon, I was assuming, because they had put me on IV heparin, which is a blood thinner, they were hoping to shrink the blood clot. It was more than likely they were going to end up having to do surgery. So I assumed, because of technology now, I just assumed that they would be able to kind of go through my groin. He very quickly was like, no, that's not how it'll happen. And I was like, so then how do they get it out? There's a good chance they're going to have to do a sternotomy and crack your entire chest open in order to get in there and to get this clot out. The reason they didn't have as many options was because the size of the clot. It was a really big clot. I had a CT scan of my lungs. We still don't really know, but we didn't know if this clot had originated from somewhere else and broke off and made its way to my heart, or vice versa. I am pretty allergic to CT contrast. We didn't have a whole lot of choice in the matter, so they pre-medicated me. I ended up having a delayed reaction, which is almost always how I've had allergic reactions. So that was then into the following day. So at this point, I think it was Saturday, like I was coughing incessantly. For me, that's like a huge allergic reaction sign. It kind of came on out of nowhere, so it scared me. Other than the allergic reaction, it was boring. I was symptomatic at that point, like pretty severely symptomatic. However, I hadn't really associated the two, so obviously once I found out there was a clot, it made sense that I was short, that's why I was having shortness of breath. Monday, the CT surgeon finally came and I finally met him. Up to that point, I had had his either fellows or PAs that would come into the room and talk to me. There's just like a thing to surgeons, and a lot of them, especially when they do really intense surgeries, there's just like a calm peacefulness about them. It reminded me of another surgeon I had had at one point, and was clearly extremely intelligent. And they had planned to have surgery Friday, so this was Monday. He came in, they were going to do surgery on Friday, which would have been like 8 days after after we found the blood clot. So I was kind of like, this is weird, they're just letting me sit here like this. But they did a special echo where they injected like small amounts of contrast for kind of each like section of the echo that they did, so that it would be really clear and they could see a lot better. As my cardiologist had requested 60 images, she ended up doing 120 images, so it took quite a while. So the following day would have been Wednesday. My nurse came in and was like, wait, like don't eat or drink anything because they may be taking you for surgery today. I was like, what? I had not prepared. I like to shower before surgeries, and this was just like, I was like, this is not how I wanted this to go. One of the CT surgeons, like PAs, came into my room a couple hours later and said, we are going to be taking you back for surgery today. It was largely because of the results that they got from that echo. I was shocked. I immediately started straightening my hair. I have a pre-surgery ritual. Straighten my hair, I get my eyebrows waxed like a day or two prior to surgery, and I get a pedicure. Well, I was supposed to go get my eyebrows waxed the day that I had the echo, like right after the echo, but obviously I ended up in the hospital, so I ended up having to cancel, which I was really pissed off about, quite honestly. And I was really just angry. Like, I had been in the hospital for 7 weeks with a really serious, life-threatening brain issue in like April and May of that year. Surgery happened in September. I was just pissed because I finally felt like I was starting to feel better, and here like this ends up happening. They ended up sending in like the head nurse from the OR, or they sent in a bunch of different people. I think like 4 or 5 people came in pretty much right after each other. And then they all came to my room, and the anesthesiologist was one of them. We talked, and she asked me if I wanted them to give me something to make me less nervous. Oddly, I wasn't nervous at all. I just kind of felt like whatever's going to happen is going to happen. It's IV Versed that they give you, and it basically makes you forget everything. I'm one of the rare people who actually doesn't like getting Versed prior to surgery. For me, there's something about seeing the OR, seeing where you're gonna be. It's such a weird feeling when you have surgery, because it's like you lived it, but you have no memory of it. You don't, like, it's just bizarre. So for me, it helps to see kind of how things look in the OR, how many people are in there. It was a lot of people, but I mean, like, probably 20, possibly more. It was a lot. And the surgeon, a couple of them kind of came in and out, because a decent amount of the surgery time, which ended up being like 6 hours, I think, was them putting me on bypass, which I'll get to. They all wheeled me to the OR, and it was eerie, and no one was talking. They ended up transferring me onto the OR bed. Several other people in the OR introduced themselves to me, which is what they had to do the surgery. There was just a lot going on in there. So it was like, okay, I can now get some Versed. So the anesthesiologist gave me some Versed. But before she did that, I had a very quick conversation, if you will, in my head to a higher power, whatever is out there, God, whatever, nature, the universe, and basically said, if this is my time, that's totally okay with me. Just please make sure that my friends and family know how much I love them. It was very quick. I had peace about it, and knew that, you know, for me, like, I just would have gone into surgery and never come out. I would never know the difference, right? Because I would have been under anesthesia, and if I died, I wouldn't have known. It would have been my family and everybody else that had to kind of deal with the fallout of it and the grief, if God forbid that had happened. The only thing that, when they told me about it a couple days prior, was being put on bypass. So I have an incision, it's like quite a few inches on kind of the crease of my leg. It's a machine that they stop your heart and they stop your lungs. They lower your body temperature to make sure that your organs and your brain don't sustain damage. But it gives you oxygen and it circulates your blood to keep everything else moving, when obviously normally that's what the lungs and heart do. That was that. The next thing I knew, I woke up in the ICU, and at one point, I think it was the surgeon that told me, we don't take straightforward cases. We only take the extremely high risk and very complicated cases that nobody else feels like they're qualified to handle, because of my health and so many complications I've had. So I was already high risk, but then add in obviously this blood clot in my right atrium, which is just like almost unheard of. It's such a rare place to have a blood clot. It's usually in the left atrium, which both are chambers, like upper chambers of the heart. So I learned more about hearts than I ever thought I would know. I woke up in the ICU, and I realized I was intubated and also restrained. Like, both of my hands were restrained to the side of the bed. I had an IV in both sides of my neck. I had an IV, I think, on each arm, and then the art line. So I was on a lot. Being intubated when you're awake is awful. Not that anybody chooses it, but don't recommend it if you can avoid it. It's just so hard to describe, but it is the ultimate feeling of like complete powerlessness. I had no control over what was going on, and finally I was able to kind of communicate to my mom, who was in the OR. It was like, or in the ICU, it was like 1:20 or something in the morning at this point. I communicated with her and was like doing this, well, with one hand, trying to explain, like, can you give me my cell phone so that I can type messages to you guys? So she finally figured it out and handed me my cell phone. It had been like an hour or two at that point. So they agreed to like unrestrain my right hand or my right arm so that I could type and have a free hand. What kept happening is my pain was really painful. Quite honestly, one of the most painful parts was the chest tube that they put in to like drain extra fluid and blood from the surgery, and it was a pretty good sized tube. That incision and those sutures ended up hurting. Like, removing them ended up hurting quite a bit more than the ones that they actually used to get to my heart. Because my pain was so bad, what kept happening is I would just stop breathing, and it's not I've never had this happen before. It was totally it was a result of the bypass and the fact that, like, you know, your lungs and everything need to wake back up and kind of get back into doing what they normally do. So it just took my body a lot longer, which is ultimately why I woke up intubated. It was this cycle where they couldn't extubate me because I would stop breathing, but then they didn't want to give me more pain meds because they didn't want the pain meds to make me have a harder time breathing. So it was this just cycle that we were kind of stuck in. But finally the nurse was like, we have to sedate her more. Like I was completely alert. I remember pretty much the entire thing. They sedated me more. I slept for a little bit. I was awake most of that time. And finally my lungs were able to stabilize, and she was like, look, if you want to be extubated, you are going to have to focus hard and really make sure you're breathing. So I did. And by this point, they'd given me a little more pain medication, so it was a little bit easier. Finally, they came in to extubate me, and being intubated looked like a piece of cake. It was awful. I also have a very strong gag reflex, and I have a massive fear of throwing up, which is ironic given how much nausea and stuff I've dealt with, but I just hate it. I also have had issues like after spine surgery, for example, and you're in so much pain that if you end up throwing up, I've had this happen, it's just painful. So I wanted to try to prevent myself from throwing up, but you know, they're removing massive chest tubes, and I coughed so hard and was gagging and whatever that it was a respiratory therapist who told me that apparently it was all normal. My lungs were like severely congested to the point that you could hear me breathing. I've had pneumonia and I've never had lungs anywhere near that congested. So my body wanted to cough to try and expel it. It was so painful. One of the things about being in the ICU is how noisy it is. You would think it would be super quiet, but there are so many monitors and machines. I said there was a chest tube. It was attached to this machine that was shaking, trying to pull fluid and blood out of what was in my body. And oh my God, it sounded like a washing machine attached to the side of my bed. So annoying. And I get overstimulated pretty easily. When I'm in a lot of pain, the last thing I want is a bunch of noise around me. I work very hard at like focusing when I'm in a lot of pain and trying to really focus on my breathing. And when there's so much noise around me, it's a lot harder to do. I ended up having pain issues. I won't get into all that, but essentially they were totally unwilling to give me pain medication anywhere near close to what I was supposed to, or what I should have had. We ended up getting that sorted out, but it took a while, and it took a friend staying overnight, a second night, literally paging the nurse every like 30 minutes until finally the pain team agreed to give me decent pain medication. After a few days, I mean, a bunch of stuff happened in the ICU, but it was all just kind of, whatever. I ended up being sent to the cardiology floor, but it's a step-down unit, so it's not an ICU, but it's not a regular hospital floor. The ratio of nurses to patients is smaller. They just monitor you a lot closer on that floor. They were phenomenal. I could not have been more grateful for their help, and they knew exactly what they were doing, and you know, they clearly, like, this is what they did all day long. As time went on, I was walking more, and I was asking to walk because when I feel decent or I feel like I can walk and it's not going to completely send my pain through the roof, I walk because I know that that helps to kind of help your body circulate better and whatever, it helps your recovery. All of a sudden, it was Wednesday, right? So this was like 6 days post-op, I think. No, it was a week post-op, actually. I woke up in the morning and had chest pain in the center of my chest. So the pain I'd had from surgery, they were able to do it minimally invasively. So I have a couple incisions. One is right under my breast. There's another, and then there's like the one from the chest tube. So they literally operated between the space in between my ribs. So, painful. Turns out that's actually minimally invasive. Heart surgeries are 3 times more painful than like a traditional sternotomy because the amount of nerve endings that they're operating by in order to get to your heart. It's also the younger you are, the harder it is to recover, which again, I would have thought the total opposite. I was shocked when I found that out after I'd had surgery. So anyway, so I woke up with this new chest pain, and all of a sudden now I was like, this is so painful. And the PA came in, who I did not like, from the CT surgery team. They had several different PAs and I liked all of them except this particular one. my cardiologist, I think, had been in. That's what it was. My cardiologist had been in the morning, and I told her, she said she was going to talk to the CT surgery team, I think, and then let them like decide what they wanted to order in terms of testing. I think she eventually just kind of overrode them and at least drew like a CBC, which shows it's just kind of a basic blood panel. And they checked my white blood cell count, which is on there. My white blood cell count, because of a bone marrow issue that I have, like never spikes. Like I've had pneumonia and my white blood cell count was like 2 or 3. Normal, I think, is like 5 to 12 or 5 to 10, somewhere around there. And my white blood cell count had spiked. I had also spiked a fever that day. And finally, the PA came by and she is like, the pain you're having is just because you're not getting up and walking. You haven't gone walking today. That's exactly why you're in pain. And I pushed back very hard and was like, look, like I have been walking. I've been asking to walk myself. Like the nurses haven't had to bug me about it. I've been asking. And now all of a sudden I'm having new pain. New pain means something is wrong. Like it's just that straightforward. If you all of a sudden a week post-op have this new severe pain in a totally different spot than where it had pain from the surgery, she agreed to draw just some basic blood work. She's the one who ended up drawing the CBC, I think, and that was it. She was not gonna keep like investigating. So my GI doctor, who I've been a patient of his, I think, for like 7 years now, he's been there through pretty much every surgery I've had, and he paged the CT surgery team himself, and it was like after hours at this point, he'd come and see me and basically said, this is a patient of mine who never complains unless there is something wrong. A good 98% of the time when I complain, they find something fairly significant on imaging or testing or whatever. But it's true. I don't, unless something is really severe, I don't complain about it. So they ended up finding that I had pericarditis, which is, there's a sac around our hearts and it's a protective sac. There's a lining of that and it's called the pericardium. That got inflamed, and what it does is instead of keeping the heart like super pliable, or the sac really like pliable and loose, essentially, it can tighten it a little bit. So what happens is, or make it a little more stiff. So every time your heart beats, it's hitting up against the pericardium. So I felt every single heartbeat. It was painful, and I mean, once we found out, I was like, oh my God, thank God, we now know what's wrong. We can treat it. They also found that there was too much fluid in my right lung, so they ended up having to do a thoracentesis, which is a lovely procedure where they do an ultrasound, they have you sit at the edge of a bed, and you're totally wide awake. They inject a pretty large needle or tube or whatever into your lung space, and whatever extra fluid is in there will drain out. So they did that. That helps. You feel better usually pretty quickly after that is done. So the PA did not come back that day. They sent somebody else, or it seemed like they sent somebody else. I was really pissed off. Like I was very firm with her, and I don't do them unless I really feel like I have to. I was crying because I was so frustrated that like, you're coming at me, yet I'm the one that's like, I'm in so much pain here. This is just crazy. So whatever, somebody else came the next day. It was really nice. And then they sent her back the following day. So she came in and I was standing up because I was getting ready to go on a walk. Imagine that. The pain had been better controlled and they figured out what was wrong. So I wasn't in as much pain and I could get up to walk. So she came in and first of all was surprised to see me not in bed, which like, ugh, screw her. And she needed to take out sutures because it had been a certain amount of time after surgery. So she took them out and she was so worried that she was going to hurt me. And I literally was like, I can barely feel that. It's fine. Like that is not painful. I didn't say this to her, but I have a really high pain threshold. I've been through a lot, and having sutures removed is like the least of my worries. It's annoying, but it's not painful like that. I was feeling better, and I'm so grateful that because she took the sutures out, I didn't have to go follow up with the surgeon's office after my surgery because quite honestly, I didn't want to run the risk that I would have her. I just didn't want to have to see her again. I ended up confronting her that day and basically saying, you know, you were treating me like you treat every other patient, and I'm not a typical 29-year-old. My health is very different. I have a connective tissue disorder that makes healing after surgeries way more complicated, and it's a much slower process. What happens for my body is I go through the process at the beginning. It's really rough, and it can take me like an extra day or two. It's not like dramatic, but then all of a sudden I will start to recover, and I recover pretty quickly. But doctors that don't know me, I've had this issue after surgeries where they're like, you have to get up and walk. And it's like, I promise I will, but I can't when I'm in that level of pain. And I'm not willing to make the pain that much worse. I did it once with one of my spine surgeries. I literally passed out because the physical therapist was like forcing me to get up, and so was the nurse. So I did, and literally passed out. We don't do that anymore. I told her that, you know, it just wasn't okay, and I felt like she needed to take that into account. Anyway, she kind of was like, well, I'm from New York, and sometimes I can be hard and whatever. But I'm really glad that I said something, because you can't just be a bitch to anyone and expect that it's gonna be okay. I consider myself a nice person, kind, sweet, whatever. But if you screw with me like that, and I repeatedly tell you, like, this is my line, I'm not going past it, and you keep pushing me to go past it, I will get very, very firm. I'm not gonna just let anybody kind of push me around. So finally, I think like 2 days later, I started to really improve. The pericarditis had gotten better. I ended up going home, and that's pretty much that. It's been a rough couple of weeks. I'm really tired, and it's been just draining. So I'm gonna keep resting, and I'll update, you know, as things progress.